Assalamu alaikum. Welcome to American Muslim Women Physicians Association online lecture series. I'm Dr. Zarin Kidwai, and today we are going to talk about acne, what causes them, and how to treat them, and what can we do to prevent them. Before I begin, I want to just give us some housekeeping instructions. Please keep your device on mute while the speakers are speaking. We will have time for questions and answers towards the end of the session. We'll have about 10 or 15 minutes. If you have any questions, you can put them in the chat box and we'll read them out for you. This lecture today is being recorded, and it's going to be shared on social media, on YouTube, and other social media as well. So please be aware of that. I'm going to begin with dua, recitation from Quran. A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Alhamdulillahi rabbil alameen. Ar-Rahmanir Rahim. Maliki yawmiddin. Iyyaka na'budu wa iyyaka nasta'in. Ihdina siratal mustaqim. Siratal lazina an'amta alayhim ghayril maghdubi alayhim waladdallin. Ameen. To translate, in the name of God, most gracious, most merciful. Praise be to God, the cherisher and sustainer of the worlds. Most gracious, most merciful, master of the day of judgment. Thee do we worship, and thine aid we seek. Show us the straight way, the way of those on whom thou hast bestowed thy grace, those whose portion is not wrath, and who go not astray. In today's lecture, we have two distinguished speakers. The first is Faseeha Raza. Faseeha is a board-certified physician assistant. She has special interest in dermatology and facial aesthetics. Faseeha is a clinical mentor for the West Coast University PA program, and she actively mentors PA students who are interested in dermatology. She is currently CEO of Sheet Derm and Aesthetics and Lung and Sleep Health Center. Her volunteer roles include chair of the SDPA Distance CME Committee and secretary-treasurer of Dermatology PA Foundation. Without much ado, I'm going to invite Faseeha to start her presentation. Faseeha.
Thank you very much. I actually would like to thank AMWPA for giving us the opportunity to be here today and present this lecture on acne. I also would like to thank Dr. Momina Mazhar, who is joining us today for treatment and management of acne, and also her expertise are going to be very beneficial. So thank you everybody for joining us today. Let's get started with acne, one of my favorite subjects. Thanks. Next slide, please. We're just going to wait for Diana to share the slideshow with us, so bear with us. Thank you so much. And we can put this in present mode if possible. All right, thank you. So as a dermatology PA, about 80% of my patients are dealing with acne, younger adults, adolescents, and also adults who come in the clinic all the time. And I felt the need that we should always, host webinars which are going to be beneficial for that population, but also adults. So understanding, treating, and preventing acne, I think, is very important. Next slide. So as Dr. Zarin mentioned, I'm a PA specializing in medical and cosmetic dermatology. I specialize in facial aesthetics mainly, and some of my volunteer roles over there. So firstly, I want to start this conversation with talking about myths about acne, because we hear a lot online. So let's just discuss them. Let's just see what we hear. Does it have proof? Does it really affect us? And how does it affect us? So one of the things that I come across, and a lot of people come across, is acne caused by diet or stress? So let's talk about it. Some things like chocolate or greasy foods are not going to affect acne, but some other things, such as dairy, can definitely affect, acne eruption or flare-ups. Stress, on the other hand, can also impact acne flare-ups, but not so much directly. And then when we talk about acne is caused by personal hygiene, we know that personal hygiene is very important, but acne instead is primarily caused by factors such as excess oil production, clogged pores, bacteria, or inflammation in the body. Let's go to the next one. It says, acne will go away over time. I mean, I think this is a little bit of a misconception. In some cases, yes, when you start with, when you're young, puberty hits and you have mild acne, sometimes it can get better, but in some cases, it may not get better, and we do need treatment for that. And also when we talk about effects only teenagers, so I would say it not only affects teenagers, but also adults at different age and stage. Next slide. All right, another one, interesting one. Is popping acne makes it go away? Is it really true? So instead, I think of it as when we pick or pop pimples, they can actually lead to scarring, hyperpigmentation, which actually takes months to go away. So be very careful when you have acne. Try not to pop it, because that can actually increase your healing time. I also like to talk about makeup. Does makeup cause acne? Sometimes makeup, and if it is not a good quality makeup, or if it is non-comedogenic, if it's not non-comedogenic, then it may cause some acne for you. So try to make sure that you purchase products that say non-comedogenic and oil-free makeup that are most likely going to be helpful for your new flare-ups and not going to cause that. It's also said that acne is only a cosmetic issue. So I personally think it's not only a cosmetic issue. I feel that it is more of a psychological issue, an emotional issue, and it can impact young adults from getting confident and presenting themselves in public. Next slide. All right. So what are the causes of acne? Factors contributing to acne. I would say number one, oil production. Overproduction of oil by the sebaceous glands can actually lead to clogged pores and acne formation. Second cause is clogged hair follicles. So our hair follicles, as you see in the picture on the left side, they can get clogged by excess production of oil, and in return, giving us some blackheads and whiteheads. Acne is also caused by a bacteria called P. acne bacteria that lives in the sebaceous glands, and it actually causes inflammation and formation of acne. Next slide. All right, some other causes or factors contributing to acne. Hormones. Hormones play an important role in acne formation. So sebum production is mainly stimulated by androgens, and that can cause acne production. Inflammation, inflammatory responses in our body can cause acne, which is one of the main causes. And then genetics. So I always, when I see someone, I talk to them, I say, well, you may have acne because you have genetically sticky pores. So by meaning that you have overproduction of oil in your sebaceous glands, which is not able to come out, and you don't have enough exfoliation on the top layer of the skin to have that clear up. And then instead we get that blockage, and that blockage helps P. acne bacteria proliferate and make things worse for you. Next slide. Medications such as steroid, lithium, and certain other medications can contribute to acne development. So when you're taking some medications, feel free to go see your doctor or even your primary care, talk to them that your acne is getting worse. And that can be one of the causes why. Some of the dietary factors, such as high sugar food and dairy consumption, may also influence acne. So always we need to watch out what we are eating. Sometimes those can be the contributing factors. Cosmetic products. So some skincare products or hair products may actually contain ingredients that can clog pores or irritate the skin, leading to acne formation. Next slide. All right, here I wanted to show everybody, types of acne. Now we see here on the very left of the slide, we see healthy skin, where we see a hair follicle, sebaceous gland, which is healthy, and there is no inflammation around it. Everything looks great. When we start getting whiteheads, we get our pore gets sealed with skin, and the clog starts to happen. And then we see blackheads, and then after that we see papules and we see pustules, which actually are pus formations within that hair follicle unit. Next slide. So there are different types of acne. I want you to think about this when you see yourself in the mirror. Do I have mild acne? Do I have moderate acne? Do I have severe acne? And based on that, you can make a decision whether your skin is getting better by using the products you have been using, or it is time to see a dermatologist. So acne severity goes from mild, moderate to severe, as I mentioned. Mild is mainly whiteheads and blackheads, like in the picture above. Moderate is more red, inflamed, pus-filled papules that may progress to the body. So you can start having acne on the chest, on the back, on the shoulders. And that means that you need two different kind of prescriptions, one for not only for your face, but also for your body. And it is very easy to get those and get that taken care of if you have mild to moderate acne. Next slide. So in my opinion, I think daily skincare is very important. I feel like using a very nice gentle cleanser that doesn't have any LHA, BHA, any lactic acid, salicylic acid is the beginning tool for you. So your cabinet, your bathroom, your room should have a gentle cleanser. And then after the gentle cleanser, I also recommend non-comedogenic moisturizers, which you can, when you go to the acne aisle in a store or anywhere else, there are so many products. I know it can be very hard for you to find out which one to pick, but I feel that if you look carefully on the words described on the bottles, you can tell which one is going to be better for you. So non-comedogenic moisturizers are the one to go for acne-prone skin. I would also recommend looking for oil-free moisturizers because, you as a patient, you already genetically have sticky pores. You have a lot of oil production. So you may want to use oil-free products, which are going to be better for you in terms of giving you any kind of acne flare-ups. Also, we can get oil-free sunscreens, which are also great for you. Salicylic acid treatments, you will see mainly in that shelving unit where acne products are sold. That is an option. Benzoyl peroxide treatment is also available over the counter. Retinoid or retinol serums are also available. A lot of kids these days are using them. But also be very careful that using it every night can give you dry skin and sun sensitivity. So making sure that you apply sunscreen, at least SPF 50 every morning when you head out for your day. Also, hydrating face mask is good to have on in your cabinet. A gentle exfoliator, or something simple as a nice acne facial or a hydrofacial even, which gives and cleanses your skin deeply with vacuum suction and infuses it with serums. So sometimes getting that and getting on top of it is very nice. Hyaluronic acid serums are also good. They can be used periodically if you feel like your skin is a little bit on the dry side. And also, I would suggest getting non-irritating makeup so it doesn't irritate your skin, causes any clogs or burns or sensitivity because you already have acne. So make sure choosing the right product is the best way to go. Next slide, please. All right, so when we talk about skincare products, After being in this practice, I've realized there are certain products that work really good. There are certain products that don't do too much benefit. But not to name any brand or anything, I would say start, have at least these 4 things. It can be any brand. It can be Cetaphil. It can be CeraVe, face wash, Cetaphil oil-free moisturizer. It can be Ulta MD UV Clear sunscreen. So all different brands. But you will know when you start using these products which face wash cleanses you nicely, which oil-free moisturizer doesn't make you break out even more, which exfoliating gel is good for your skin. So all of these things, when you start using them and when you even see a provider, they will guide you also which ones to start trying with so that you are on the right route of using great products. So these are just a little bit of few examples. Next slide. So here I put in some products that I usually recommend. Some of them, the prices may vary because of the brand. Some of them are medical grade skincare. The other one is over the counter. They're all good. I'm not saying one is worse than the other or one is better than the other, but CeraVe acne control cleanser, you can easily find it in your grocery store. LHA cleanser also, it's not that hard to find LHA cleanser. It's SkinCeuticals. It may be present at one of your dermatology practice. Cetaphil, and then I also have heard good things about Hydra Boost Gel from Neutrogena, that you can find it very easily. And this one is because it's a gel base, it is very easy and it goes on your skin very light. A lot of my acne patients love this and they use it daily. Also, I like different sunscreens. Ulta MD is one of them. It is SPF 46. I usually recommend SPF 50, but since it is close and it is a good product, it's very light, it goes on like a lotion, I like it. Next screen, please. All right, so once you have these products, you have been using over-the-counter things and even the pimple patches and everything like that, but nothing is working. Now, what should we do? I think at that time, we need to go to a doctor. I think we need to see a provider who can actually guide you and look at the products that you have been using and then guide you in terms of whether you need to continue using over-the-counter products that can help you achieve this clear skin, or maybe it is time to get you started on a gentle tretinoin cream, which is basically going to help you clear your acne. So consultation is very important. Get educated, get to know what you have, and then use the right products or the prescriptions that you need. Next slide. So when you come to consultation days, sometimes you don't know what you're going to be asked. I actually wanted to get everybody prepared. So for example, if you're thinking about going to a dermatologist or a dermatology provider and asking them, okay, what's going on? My acne is not getting better. So get ready to answer a few questions. We're going to ask you about your past medical history, meaning, how long this has been going on, what products you have been using, what makes your acne worse, what makes your acne better. I always like to ask this question, is it a good acne day for you or a bad acne day for you today? That tells me a little bit about them, that today is a worse day. It's not as good as it used to be. Also, we will ask you questions like, what skincare products you use, what is your daily routine like? So make sure that you bring some of your existing products or patches that you have been using at home to the appointment so we can take a look at it and let you know what you should use every day and what you should alternate days. Because sometimes if we use a lot of retinol or some of the exfoliants daily and incorporate in our routine, it can dry your skin and instead make it more sensitive to anything else. Also, prescription medications. If you have been using prescription medications, I would advise you to bring them with you just to know, so we know what you have been using. One important thing that I have noticed is sometimes, the prescription medications you were prescribed about a year ago from one of your providers, it is not working anymore. It has lost its potency. So it is important that we keep it fresh within the 3 months of prescription time and go from there. Next slide, please. So from consultation, then your provider will talk about the treatment and management options. And I think at that time, you'll be in a good position to, follow that treatment. And then management requires a little bit of homework and a little bit of things that will come from you. And I will briefly talk about it. But after me, Dr. Momina Mazhar will talk about treatment options, side effects and all that good stuff coming up. And then she will also talk about management. But here is some management tips that I would give to my patients. Next slide. So I usually tell them to stay on top of their treatment. I would say exactly use it as prescribed, understand your skin needs, and make sure your acne doesn't get worse. So give me a call if your acne is not getting better. Understand medication, use the medication on time. When you get a flare-up, you should stay hydrated, eat healthy diet, keep your hands away from your face, especially when you're working out. Wash your face with a cleanser designed for your skin type. Also avoid too many different types of products or over-the-counter products at one time. And make sure you follow up on a regular basis with your dermatology provider, because that is going to help you maintain your skin in good condition. Next slide. Thank you very much. And I tried to encompass a lot of information in this PowerPoint presentation. Here's my contact information. And I'm going to hand the mic to Dr. Momina Mazhar. And thanks for joining us. I appreciate your tuning in.
Thank you so much. I'm going to share my screen now.
And before Momina gets a chance to start speaking, let me give a brief introduction of her. This is Dr. Kidwai again. So Dr. Momina, she grew up in Maryland. She went to college in University of Maryland and did her medical school from George Washington University in Washington, D.C. Dr. Mazhar also worked as a researcher at National Cancer Institute, U.S. Army Research Institute for Infectious Diseases, and Johns Hopkins University Hospital. She is currently in her final year of residency in dermatology at UT Southwestern in Dallas. Welcome, Dr. Mazhar. Welcome, first of all, to Texas. And you can begin now.
Thank you for the introduction, and thank you so much to AMWPA for inviting me for this talk. I'm going to be kind of piggybacking off of Faseeha's talk and going deeper into the treatment and management of acne from a dermatologist's perspective. This is kind of my treatment algorithm. So we'll start off with the over-the-counter topical therapies that have already been mentioned, and then we'll do a deeper dive into the prescription topical as well as oral therapies. We'll talk about isotretinoin, which is also the brand name Accutane. I know a lot of people in our community have questions and are interested into complementary and alternative therapies. And then I'll mention briefly some physical modalities used for treatment as well. So the first topic is over-the-counter topical therapies. When you walk into that acne aisle, you're going to be overwhelmed with a number of products. And I have a lot of patients come to me having tried many of these products. And they're products that range from adapalene, benzoyl peroxide, acids, et cetera. I think when you look at these products, you want to see what active ingredient they have in them, because you don't want to overlap certain active ingredients and destroy your skin barrier. One of my go-to over-the-counter active ingredients is adapalene. It's the only over-the-counter retinoid that's available. It used to be available only through prescription, but now it's over-the-counter and it's pretty cheap. Some of my patients who have sensitive skin, instead of starting them on a prescription level topical steroid, I'll have them just go to like Walmart or CVS and buy adapalene, which is like $10 or $20, and start using that. The 0.1% gel or cream has the same efficacy as tretinoin 0.025%, which is prescription. And that was found to be true in a head-to-head study. Benzoyl peroxide, you'll see many times in face washes. It's anti-inflammatory, antibacterial, and it's a good add-on for acne. I have my patients who have a lot of chest and back acne use it as sort of a body wash. you have to be careful. It can sometimes be irritating, and it can bleach your clothes and your towels if you don't wash it off. We've got the acids, so there's AHA and BHA combined acidic peels. The Ordinary and Paula's Choice, they have really popular products. AHA acids are water soluble and BHA are more oil soluble. So salicylic acid is an oil soluble vitamin or acid, and that's good because it can get inside of your pores instead of staying at the superficial level of the skin. Azelaic acid is also good for redness. So some people with lighter skin, instead of getting post-inflammatory hyperpigmentation, they'll get post-inflammatory erythema, so red patches that are left on the skin after the acne goes away, and azelaic acid is good for that. One lesser known treatment is sulfur. It's not great for acne, but there are some sulfur-based spot treatments available for acne. It's a very good anti-inflammatory medication. All of these active ingredients come in multiple different formulas, whether they're face washes, gels, creams, or pads. What I like to say about these over-the-counter products, and the mistake that I see patients make when they come to me, is that they're using way too many products at one time. So you should not be using more than one or two active ingredients at a time, trying it out for like a month and then adding on another one. Otherwise, you're going to make your acne worse. People will watch TikTok or Instagram and they'll say, you know what, I need to add this. And it's nice and fun to buy stuff for yourself. But when it's too much, then it can destroy your skin barrier. Moving on to prescription topical therapies. So these are a little bit stronger than what I mentioned previously. You can't get these without seeing a licensed provider. So retinoids, similar to adapalene, we've got tretinoin and tazarotene, which are go-tos for us. I never have an acne patient who's not on a retinoid unless they're like pregnant. It's like one of the first line treatments for acne. Adapalene can also be prescription at higher strengths. And so I always start off my patients on a lower dose of one of these retinoids and then have them hopefully tolerate it frequently enough. And we bump it up at every visit if possible. We've got topical antibiotics such as clindamycin, erythromycin, and dapsone. Like Faseeha mentioned, acne is caused by many different things, and one of those things is a bacteria that lives on your skin. So acne is primarily an inflammatory condition, but there's also bacteria that play a role in it. So the antibiotics help with that aspect. And then there are other topical therapies available that are prescription, like higher strengths of azelaic acid. A lot of the treatments that I've mentioned are not safe to use in pregnancy, but azelaic acid is one of those topical treatments that is safe in pregnancy. We've got chemical peels as well that are done in office. I'll mention those later on. And then there's a newer treatment for acne, which is clascoterone. It targets the hormonal aspect of acne. And there aren't any head-to-head trials to see if this topical acne treatment works better or the same or worse than the ones that we already have available that are more easily covered by insurance. So clascoterone, not many providers will prescribe it because it's so hard to get covered by insurance just because it's so new. Next, we have the prescription oral therapies. If you come to me and you have hormonal acne, if you have inflammatory acne, which means red bumps on your face, I will most likely be prescribing you an oral therapy. There's different classes of oral therapies. So we've got hormonal, antibiotic, and then we'll talk about isotretinoin or Accutane. Hormonal treatments are reserved for women. So they include combined oral contraceptives and spironolactone. Corticosteroids are a type of hormone. However, they're not given specifically to treat acne. They're given in conjunction with isotretinoin in cases of very severe acne. So combined oral contraceptives and spironolactone are used in women who get hormonal flares. So these are women who get flares with their periods, or they have other things like hirsutism, which means excess facial hair, that indicate that there may be some sort of underlying hormonal component to their acne. A lot of women with underlying PCOS will have acne because of that condition. And in them, there's kind of an imbalance of male and female hormones. So we give those patients these hormonal prescriptions. Again, acne is an inflammatory condition as well as something that's influenced by your bacteria. And luckily for us, these oral antibiotics not only have antibacterial properties, but they have anti-inflammatory properties. So the main the main oral antibiotics that we use are doxycycline and minocycline. They're in the same class of antibiotics. There's others, if those don't work, such as azithromycin, erythromycin, and trimethoprim, sulfamethoxazole, which we don't really reach for nowadays because doxy and minnow work so well. Doxy is very well tolerated. It can cause upset stomachs, so we ask people to take it with lots of food and a full glass of water. Minocycline can be used if doxycycline isn't working as well, but you don't want to be on minocycline for a really long period of time because it can cause skin discoloration. And then the big gun medication we've got is isotretinoin, also known as Accutane. Some people will get the conventional dosing. They'll take it for a certain period of time. You essentially take it until you reach a certain goal dose. Usually for most patients, it's about 6 to 8 months of treatment. And then there's also low dose Accutane, which can be used for moderate acne. There's lots of monitoring involved, and I'll talk about that. So Accutane, people have a lot of questions about side effects. If you go to this side of TikTok, you're going to see a lot of positive TikToks and social media commentary on isotretinoin. You're also going to see a lot of negative commentary on isotretinoin. I prescribe this very frequently, and luckily, alhamdulillah, I haven't had any complications that are severe in my patients who are on Accutane, and I think most dermatologists can say the same. If you take any medication, what I tell my patients when they start this, or anything, anytime you put something in your body or anytime you put something on top of your body, there's a side effect associated with it. You are taking a risk. And it's important to know what those risks are. So there's no medication in the world that doesn't come with risk. And isotretinoin is the same. So 90% of people are going to get a side effect on isotretinoin. And the side effect that they're going to get is dry skin, most commonly dry lips, dry eyes, dry inside of your nose is the nares. Isotretinoin increases skin turnover, so that's why it causes your skin to be dry. It destroys the oil glands in your skin. It's the only medication that actually destroys the oil glands in your skin, which is why it causes dryness of the skin. When you take a standard course of this medication, the side effects are temporary and they resolve without sequelae. There are some reports of mood changes on isotretinoin. I know personally, like 1 or 2 people who just don't feel like themselves while taking the medication, and so we lower the dose or we just take them off of it completely. And there was a black box warning on increased risk of suicidality on Accutane, but there have been numerous other studies that came out after that showing that in fact isotretinoin has helped patients with depression and anxiety because it gets rid of their acne. There were 2 reported cases of premature growth plate closure in children. So that has to do with growing bones in children. And in these patients, unfortunately, it led to stunted growth, but it was only 2 case reports. And I know personally many pediatric dermatologists, they have like generations of patients come to them for isotretinoin. So they'll have an older sibling that they treated, and then their parents bring back their other 2 siblings for isotretinoin because it works so well, and they have never encountered this type of side effect in children. Another major side effect is increase in your triglycerides and cholesterol. So you want to have a healthy diet while taking this medication and get this blood work monitored. And then when you are on Accutane, you need to participate in the iPledge program. Any licensed physician or provider has to participate in this program. Essentially, this is kind of like to gatekeep the medication, and it kind of makes it a little bit more difficult to access because the major side effect for this is that it can cause very, very severe birth defects. So this is not a medication that you can have unlimited refills on. You get 1 month supply, you come back to your doctor, you take a pregnancy test, and then you get another month's supply. If you're a male, you still have to participate in this program. And then you want to take it, it's a fat soluble medication, so you want to take it with food. And then in patients with very severe cystic acne, we'll sometimes give it with a course of short course of oral steroids, because you can get this like purge phase and get very, very severe breakout in the beginning, like first 2 months of this medication. Then we have complementary and alternative therapies. Growing up in a South Asian household, we did a lot of turmeric face masks growing up. And that's really common in our culture. So I thought I would bring up this slide. There aren't a whole lot of studies on complementary or alternative therapies, so I can't comment on a lot of things because there just aren't any data to support them. But what I did find is that topical tea tree oil has been shown to maybe be as effective as benzoyl peroxide wash when it comes to treating acne. You want to be careful anytime you put essential oils on your skin because they're incredibly irritating and can lead to contact dermatitis. So it's not something that I routinely recommend for people. A few studies have shown that oral barberry extract may be beneficial for patients with acne. And then zinc supplementation has pretty strong evidence to go for it. I know a lot of these like, over-the-counter acne supplements have all these random ingredients in them, but I think the thing that's working the most in it is the zinc. Zinc is known to support your immune system and also help with wound healing. In fact, when we have kids who come with warts, we recommend zinc supplements for the kids because it boosts their immune system and helps their body fight the virus that's causing the warts. An interesting paper I found is on this Himalayan purifying neem facial wash, which contains neem as well as turmeric. Turmeric contains a compound called curcumin, and curcumin has been shown in like a multitude of studies to be antibacterial as well as anti-inflammatory. And this study compared patients who used this wash to patients who didn't use it, and in the patients who used it, up to 79% of them showed a reduction in their acne, reduction in sebum level, which is oil producing in the skin, and then improved skin hydration as well. So I think I'm not going to dismiss any of the wisdom that our ancestors had when it came to like at-home treatments. I think there's benefit in a lot of these things. It's just that they haven't been studied or researched enough for me to say much more on them. And then diet and exercise. This is a question that a lot of people have when it comes to acne. There is an Australian study that showed that a high glycemic index is associated with acne, but there's no specific dietary changes that are recommended for patients with acne specifically. We know that whey protein worsens acne. And there's limited evidence to suggest that some dairy, specifically skim milk, may affect acne. And if you look at skim milk versus whole milk, you'll see that they kind of have a similar caloric density. And it's because skim milk, although they've taken the fat out, they've supplemented skim milk with whey protein to boost its caloric value. Even though it's like super watery, they put whey milk in it to add more calories to it, and it's probably the whey milk in the skim milk that worsens acne in the patients who drink skim milk. When it comes to diet and exercise, I emphasize that it's important for all aspects of health, not just acne. I think in our age and in our society, we are not as active as our ancestors used to be. Our ancestors and our human bodies did not evolve to sit at a desk for 8 hours a day. Our ancestors did not have the luxury of walking 10 steps to the refrigerator and eating whenever they felt like it. Our humans have gone through periods of hunger. We were, hunter-gatherers. We were always outside, like tending to animals, tending to livestock, and growing our own food. We were always active. And now, in the past 100 years, that's completely changed. And so we have a whole set of other chronic conditions that are killing us. So I think a healthy, balanced diet and exercise is important for everything. Now, is there specific exercises or weight loss regimens that I recommend for acne? No, but I think it goes into taking care of your body. And I think taking a holistic approach is more important than just focusing on what face wash you're using. And then there are other physical modalities for treatment. So these are more like cosmetic treatments that you'll get in the office. They're not covered by insurance and they're expensive. And I honestly reserve these for patients who have undergone acne treatment. So if they've undergone, doxycycline and they're clear, or if they've undergone isotretinoin and they're clear, but they're left with these like hyperpigmentary scars, erythematous scars, or if they're left with these like ice pick scars, we'll do some chemical peels, we'll do lasers for the scars and for the redness. There is a new laser that targets the sebaceous glands or the oil producing glands in the skin that people with acne use for their acne. I've never personally used this. I don't think we have that laser available, but I can imagine that it's probably more expensive than just going on Accutane or taking doxycycline or even doing some of the over-the-counter stuff. And then there's intralesional Kenalog. So if you have a really big, like you have a singular big bump on your face, and it's really bothering you, I would highly recommend going to your derm provider and getting it injected with Kenalog. That can help with the inflammatory aspect of it, and it can help it from getting worse. So that's one treatment from this slide that I would recommend if you have active acne. And then here are my references. And that will be the end of my portion of the talk. Thank you.
Thank you, Momina, and thank you, Faseeha. You both spoke so well, and you pretty much covered everything. Looks like our audience learned quite a lot because there are not many questions in the chat box. There are two, though. The first looks like is for Dr. Mazhar. Is there a mixture available with neem and turmeric, or one has to make one yourself? And what are the proportions? Dr. Mazhar, do you have any information on that?
Yes, sorry, I wasn't able to unmute. I'm going to stop sharing. So the neem and turmeric study that I was talking about spoke specifically about this brand of face wash called Himalayan neem and turmeric face wash. It's not a first-line treatment for acne, but it was just a study that I found. I wouldn't recommend making anything at home to put on your face.
And the next question is, does fat-free milk increase or decrease acne?
So in the study, they showed that it worsens acne. Fat-free milk worsens acne. But whole milk has not been shown to worsen acne.
I use a lot of fat-free milk in my house. I need to change that practice.
It doesn't have any nutritional value in it. It's just water that looks white.
Okay. One must learn more. Are there any more questions, audience? Do you have any question for either Dr. Mazhar or for Faseeha? Okay. So here's one. My daughter is 13. She has acne on T-zone. What is your recommendation?
Is that for me or Faseeha?
So definitely, I mean, I can take this one. Definitely, I think she should come in and see one of the dermatology providers, especially if it's lingering on and it has not been getting better over time. Maybe she needs a very gentle, a very mild treatment, but definitely needs evaluation so we can guide her better.
Yeah, I agree. I think it's important to have these patients seen in person.
Mm-hmm.
When I was on social media, I had a lot of questions about, I have this, what can I do? I have that, what can I do? One, we're not allowed to make recommendations. We're not allowed to give healthcare advice outside of the office, and two, seeing in person is so much more valuable, and you as a patient deserve that.
What % do you recommend for azelaic acid topicals?
For azelaic acid, there's a good one by Paula's Choice that's available over the counter, and I think it's 10%. And the 15% formulations are only available prescription.
The next question is, which over-the-counter products can one use with tretinoin, since it is an active ingredient?
I can take this one. So if you're on tretinoin, depending on the dose of tretinoin cream that you're on, if you're at 0.025%, it is mild. You may be able to use another serum in the morning, but definitely if you're on a prescription cream, I would suggest just use that first to take care of your acne. And if it doesn't get better, then use any other over-the-counter salicylic acid products or even benzoyl peroxide. Because again, your provider may actually combine two therapies for you, but once they start you on one medication, we have to wait and see if that is enough for you instead of drying your skin or causing more sensitivity with multiple products. So I would suggest hold off of any products that have any kind of exfoliant in it at that time when you start using prescription tretinoin.
How about acne on the back? It is hard to reach to cleanse at times, and my teenage is frustrated at times.
Yeah, for back acne and chest acne, I like benzoyl peroxide, and some of my patients, I have them use like a salicylic acid spray. I think there's a brand called Naturium. It's found at Target, and they have this 2% salicylic acid spray that I like. But for, acne that's on the face, chest, back, and it's extensive, that will need like a consultation, and that person probably needs like a pill to take for extensive acne.
I have a question for Dr. Mazhar. As an internist and primary care physician, I often get asked this question about patients wanting to check their hormone balance, quote unquote. Now, I know as an internist, there is no value in checking hormone levels in treating or diagnosing acne. What is the recommendation for this? Do patients, what do we tell the patients?
Yeah, I think that's a really good question. Patients really like wanting to know what their hormone levels are, but I think it's hard to explain to them that it's really difficult to capture your actual hormone levels in these tests. And a lot of it depends on your cycle and what part of the cycle you're on. But I think in the case, like 1 or 2 cases where I've checked hormone levels, it's because I was trying to figure out an underlying endocrinopathy. And it's patients with other symptoms that kind of point to these. So like a young patient with crazy high blood pressure, women with excess facial hair, and severe cystic acne and abnormal periods. So it's in those cases. But if you have just regular schmegular acne vulgaris, there's no role in checking your hormones because it's not going to tell you anything. The question that I ask when determining whether or not it's hormone related is more so in women. And I just ask them, does it flare around your period? Does it cycle with your period? And if it does, that's when I recommend like spironolactone or OCPs.
Yeah, that's very valuable information. And it would be helpful to educate our patients who ask this question. Yeah, thank you. Do you have anything else to add? Or Faseeha, do you have anything else to add?
I just wanted to add a few things, especially when a patient is using tretinoin and their skin gets a little sensitive after using it. what happens is they may feel burning and tingling whenever they use any other product on their skin after using tretinoin for about a week or so when they initially started. I tend to tell my patients to take a Q-tip and put it in Vaseline and then put it in there around their nasolabial folds right here just to protect the skin from any damage that tretinoin may cause or sensitivity, because this area, nasolabial fold area and under eye area, is very sensitive, and that's where usually the acne is not there. So just taking a little bit of that Aquaphor, putting it here under the eyes, and then applying your cream can help solve a lot of problems of those dryness and sensitivity.
That's a great
Thank you very
tip.
much. Yeah, something to add? Sorry.
Yeah, I'm just gonna hop off that, and I think like compliance to these medications is really important, and tretinoin is a medication that I have a hard time getting my patients to comply with because it can be so irritating. So if you're starting off using tretinoin or any sort of like topical retinoid, you want to start off by using like, every other night or even just 2 to 3 times a week. And the way that I like to use it is I like to put on at night, I like to put on my moisturizer first. And then I like to take a little bit of the retinoid, put it all over my face. I like to apply it down to my neck. And if I have a little bit left over, I apply it to the backs of my hands because it prevents wrinkles. That goes off of the next question, how to keep your face wrinkle free. Just use tretinoin for the rest of your life. Yeah, so I use my moisturizer, my tretinoin or retinoid, whichever one, and then I put another layer of moisturizer on it. And there's actually a study that showed that if you use a moisturizer before you use your retinoid, it actually helps the retinoid absorb better into the skin.
Very good point.
I suppose it is time to conclude this. This has been recorded and it will be posted on YouTube in the next few days. So look out for it. And our YouTube channel is amwpa.org. There are other educational videos of similar nature. So you can check it out. And if you subscribe, you will be getting alerts about our future events also. Thank you very much. Thank you, Faseeha, and thank you, Dr. Mazhar. Very enlightening information and very useful for all those who are taking care of children who have acne or children themselves who have acne. Thank you very much.
Thank
Thank
you.
you.